All right, hi guys. Welcome to one of the last weeks of e-learning. We can do this. All right, so on Thursday, I had to do a web quest about abnormal psychology and the different therapies and treatments involved. I am going to upload a copy of the answer sheet. Now, I will say that my answer sheet looks a little bit different than what you did, especially question 10. I reworded it for you guys. What I have is the old version. The boxes on the first page are also a little smaller, so the first 3 questions from the second site are on that instead of the first 2. So, but the questions are still the same, but the material is still the same. I apologize in advance for my handwriting. It is not always fantastic on the iPad. So that is posted here, but I'm going to go through and explain the different things to you, and then all you have to do today is complete a check for understanding about abnormal psychology therapies. And that is it for today. And then tomorrow and Thursday, you guys are going to be watching a video through YouTube about the man who popularized lobotomies and made them, more accessible through very horrific means. It's terrible. It's absolutely horrendous, but it is a very crucial time in American history and in the world's history in general for how we deal with psychological disorders. So it's important to learn about and to see how far we have come. But as you watch it tomorrow and Thursday, it's sad, and it's pretty traumatizing. Not for us, but people who had to go through it. I mean, if you're squeamish, there's a couple of moments, but it'll be okay. Anyway, so we're going to talk about the different therapies. So I have my iPad up. I'm going to explain to you real quick, and then you'll be free to take your check for understanding. Okay, so the first thing I had you do was list the 5 like talk therapy type things. So the different approaches to treating abnormal psychology. You should have psychoanalysis or psychodynamic, behavior, cognitive therapy, humanistic therapy, and integrative holistic therapy. So we'll start with psychoanalytic because it is the oldest and move our way down. So psychoanalytic theory, we want to change problematic feelings and behaviors, which will help us fix the problematic thing that's going on. We want to find out the unconscious meaning. We want to figure out what's driving the behaviors. If we can figure out what's driving those behaviors and change it, then we can move on. And again, this is the theory that was pioneered by Freud and then Jung and Adler. They're very much concerned with the unconscious, with repressed memories, with things that happened in our childhood, and how they might affect us now. So you have to have a very trusting and close working relationship between the therapist and the patient. And typically the therapist is in the position of power here. So they are the ones interpreting what you say and then telling you what you should do. So you present a problem, the therapist interprets, and then you go from there. So then we have behavior therapy. All right, so we want to look at learning's role in our behavior. So what happened to teach you to behave a certain way, and can you be taught to behave a different way? So for example, if you have a phobia, okay, which would be a psychological disorder, especially if it's severe enough to impact your day-to-day life or significant events in your life. So if you have like agoraphobia, so fear of spiders, you might go see a behavioral therapist to get that training, either classical or conditioning style training to slowly build a tolerance to spiders. Maybe you're never going to like them, but you're not going to run out of a room screaming if you see one. So you're looking at rewards and punishments, for operant conditioning. You want to do desensitization for classical conditioning. We're going to be using those learning behaviors to alter the behavior itself. So behavioral psychology in this situation only helps with the behaviors. It's not really trying to address the core cause of the problem. It's just trying to help you adjust your behavior. Then we have cognitive therapy, which obviously cognitive is mental. So we're trying to change how we think about things. So dysfunctional thinking leads to dysfunctional behavior. We want to change how you think. So somebody who maybe has depression might see a cognitive therapist. So you would work with your therapist to identify thought patterns that you have that lead to depressive episodes or downward spirals, and you and your therapist would work together to come up with strategies to kind of limit those things or adjust the way you think. So if, thinking about your grades or your future college, whatever, is something that triggers that depressive spiral, your cognitive therapist might say, okay, you need to learn how to recognize when you're starting to go down this path, and then here are steps to kind of help you move your way out of that path. Again, we're trying to change how we think, not the cause of the problem, but, recognize, okay, this is what's happening, this is what's going on in my brain, how can I move from this path that I'm on to something more productive? All right, then humanistic therapy goes back to humanist psychology. It is, again, emphasizing the individual and how the individual has a huge potential. You want to self-actualize, etc. This is very client-centered psychology. This is not one where the therapist would be interpreting it for you. They would just provide the framework for the discussion to occur, and you would be in control of, the steps in the process. So the therapist is there to help and support, but the client themselves, the patient themselves, is driving the growth. So like they talked about client-centered, Gestalt, and existential therapy, but really the big thing here is focusing on the individual and the potential that you as a person has. And then the last one is integrative holistic therapy. This is kind of a combination. So you're going to pick from different theories and styles to best treat the patient. Most psychologists would use integrative holistic therapy. At this point, pick the theories that are going to help your patient the most. And that's not going to be the same for everybody. Okay, so then I had you go down to look at the medical model, because this is probably the most common way we see people being treated today. So, medicine over talk therapy. Now, I will say most reputable psychiatrists and psychologists, if they prescribe a medicine, would also recommend talk therapy as well. So not just taking the medicine, hoping that'll solve the problem. Take the medicine and also try to address the roots of the problem or the roots of the behavior. All right, so medical model, question 1. What do supporters of this approach believe about treating abnormal psychology? And the point here is that they believe that there's a physical cause for the psychological disorder. We might not know exactly what it is, but we know that there is something, whether it's wiring in the brain, dopamine or hormones or neurotransmitters that are being, overproduced or underproduced, brain damage, etc. There is something in the body that causes this abnormal psychology event to occur. So the process of how someone is diagnosed with a disorder in the medical model. So they're going to look at the behaviors of the individual. So behaviors are equated to symptoms with a disease. So if you have certain behaviors, you may have this specific disease or disorder in this situation. And then diagnosis is based on judgments of behaviors. So if you ever become a teacher, for example, there will be times throughout your career where you will be handed a packet, and that packet will be a bunch of questions about a kid, ranging from like, how did they behave on the playground, which for me, I can never answer because you guys are high schoolers, and to how they behave in class, and you rank them on a scale like 1 to 5, or almost never to always, that kind of thing. And you go through these different behaviors. So people who are in different positions in a child's life or an adult's life would fill out these questionnaires, send them into the psychologist or the psychiatrist, technically, because those are the only ones that are medical doctors. And they would then look at all of these behaviors from across the board. And if they start to see commonalities, they can use those as, symptoms to diagnose the behavior. All right, so question 3, what is the doctor's judgment based on? Again, questions and observations of the patient and, the people, like the teachers, the parents, the religious leaders, bosses, that kind of thing, who fill out these surveys. Okay, so what kind of treatment might a doctor prescribe to deal with psychological disorder? Again, you might have drugs, psychosurgery, or electroconvulsive therapy. In addition, to talk therapy. Again, most psychologists and psychiatrists would recommend talk therapy as well as the drugs. Of the three things I mentioned, drugs, psychosurgery, and electroconvulsive therapy, drugs are by far and away the most common. Psychosurgery is hardly ever used today, same with electroconvulsive therapy. Okay, so OCD, schizophrenia, and depression, they highlighted to show like the physical basis, the biological explanation. So OCD, we tend to see this follows along genetic paths. There's serotonin deficiency, orbital frontal cortex issues, the environment that you might be raised in. These are all commonalities that we see. Schizophrenia, there seems to be a predisposition. Again, there's a genetic link. If your parent has if a parent has schizophrenia, you are more likely to develop it as well. But that decreases the further away in the family tree that you are from the person with the diagnosis. Again, we see dopamine issues, and then there may be some differences in the brain structure. All right, and then depression, again, predisposition with genetics, low levels of various things, serotonin, dopamine, yada, yada, yada. So we tend to see, release of stress hormones at a higher rate, that kind of thing. So there does seem to be a biological basis of this, which we talked about in Unit 3 when we talked about biological basis of behavior. All right, so then I had you look at the effectiveness of drug therapy versus the appropriateness of drug therapy. So the effectiveness of drug therapy, all right, so it's very cheap. Most people are able to, or have their insurances, are able to afford drug therapy. They reduce the symptoms very quickly for most patients, and this is helpful in regards to behaviors. But here's the thing. Okay, hold on, I'm going to do another thing first. All right, so most people who advocate for drugs say that drug treatment is better than no treatment, while most people will just do the drugs. They'll ignore that part about going to talk therapy. They'll say drug treatment is better than no treatment. And in that point, 50 to 65% of patients are helped by the drugs that they are prescribed. So, I mean, over half of people who are prescribed these drugs are benefited by it. This is better than none of those people being benefited. However, drug relapse is very likely if you stop taking your medicine, which happens regularly. People will take their medicine, they will feel better, and then they'll stop taking their medicine because they feel like, oh, I'm good, I'm cured, or they'll feel like maybe the medicine is doing something different, and then you just kind of go through that cycle. So it is very important if you have a psychological disorder or depression, whatever, that you continue on the regimen that your doctor has prescribed. It's just important to do what the doctor says. And then appropriateness of drug therapy. All right, here are the big questions and big issues. Drug therapy does not deal with the actual cause of the problem. It deals with only the symptoms. So it only treats the symptoms. We haven't yet found anything that actually deals with the cause of these psychological disorders. There are major side effects for many of these drugs. I don't know how many of you guys have watched commercials about different drugs, and my favorite part is they always have something happy going on, or light music, something that so you don't focus on the words. But then they're talking about things like side effects may include heart attacks, liver failure, death, yada yada, all these horrible things. So there are major side effects, and sometimes you have to take additional drugs to treat those side effects. So you tend to see a snowballing problem. People tend to want drug therapy because it's cheaper and doesn't involve as much work as talk therapy. So while talk therapy would be very helpful, most people will only do the drugs, which, again, most psychologists and psychiatrists would say does not effectively address the problem. You have to figure out what's going on inside your own head, know how to think about it, know how to deal with it, in addition to taking the medicine. All right, drugs can cause dependency. People can be addicted to it, and if your drug supply runs out, or if you can't get a refill on your prescription, you will relapse. So this is a problem. And then there are ethical issues about consent and whether or not somebody has the right to force you to take medicine. which does happen in certain situations. The courts can force you to take medicine if you prove yourself to be a danger to others or yourself, that kind of thing. And so there's a problem. There's that ethical dilemma. Is somebody who's going through a psychological break capable of making the decision to allow the drugs or not? And if somebody says, don't give me the drugs, should we follow that request? There are a lot of issues. Most people in day-to-day life, not really going to be affected too much by that one, but people who are in prison or jail, people who are in psychiatric institutions, things like that. This is something, children also, because parents make the decisions for children. These are things that are really big, important questions when we're talking about the ethicality of what we're dealing with. All right, so then electroconvulsive therapy, this is where they literally just shock the brain with electricity. Not entirely sure why it works. Sometimes it works, sometimes it doesn't. Again, this one has fallen out of favor for the most part. It's only used to treat really severe cases of things like OCD and schizophrenia, bipolar disorder, that kind of thing. All right, psychosurgery is where you physically cut or remove or alter the structure of the brain. So there are a lot of issues associated with this. Anytime you mess with the brain, you are messing with somebody's personality potentially, the way that they think about things, their ability to do things. So the side effects can include what's called vegetabilization, where you're numb without personality. And the other problem is, if this doesn't cure the problem or treat the issues, it is an irrevocable decision. You cannot reverse this surgery. You will never be the same as you were before the surgery. So psychosurgery is the absolute last resort when it comes to treatment for psychological disorders. You will try everything else first. So talk therapy, drugs, other drugs, new drugs, clinical trial type things. And if none of that works, and if you fall into the very specific categories where we allow psychosurgery today, then you may end up getting one. What you guys are going to be watching on Wednesday and Thursday is about psychosurgery and lobotomies and kind of how they were dealt with to begin with. And just keep in mind, while we still do lobotomies today, they are definitely done in a surgical setting with qualified people and not at all like what you're going to see in the movie tomorrow and on Thursday. So for question 10, what's on the paper that I uploaded for you guys looks a little bit different from what you guys answered. So lobotomies can be used to treat things like schizophrenia, depression, OCD, abnormal aggression. There are different types of lobotomies that address different parts of the brain, but there are a number of side effects. For example, inability to plan ahead, indifference to opinions of others, you might be childish, flatness of intellect and emotions. You could die. This is a big surgery and it can kill you. Major personality changes, epileptic fits. Anytime you mess with the brain, it's not necessarily a good thing, which is again why this is a surgery of last resort. So while we do use lobotomies, it is a last resort situation. All right, and then the last question I had was for you to fill out this diagram. So what are the strengths and what are the weaknesses of the medical model? So the strengths, it's objective, based on science, things can be tested. It does give insight into the conditions. Treatment is very quick and easy and cheap relatively. Even if your medicine costs, $100, $200 a month for a psychological disorder, that's still going to be cheaper than therapy for most people. And then it is pretty effective in controlling the symptoms. And because we now see people with psychological disorders as just sick in some way, this removes a lot of stigma. So people don't look at people who have psychological disorders the same way that they used to, where they would be ostracized from society, tried to be, hidden away from everybody. So there's a lot of positives about the medical model, but it is important to keep in mind the negatives, which are major side effects, deals with the symptoms, not the root of the problem. They still have not found any physical causes of specific psychological disorders that they can say for certainty, people who have this will have that. And then again, we see those ethical issues, things like if you give a lobotomy, you're irreversibly changing somebody's personality, or is it right to force people to take treatment, things like that. Again, the dependency, all of that stuff. So there are very big positives, but there are very serious negatives, and it's important to keep both of those in mind. All right, so now that we've gone through this whole thing, you guys do need to just quickly take the Check for Understanding assignment, which is posted with today's e-learning. So this, with the review, is one material, and then the assignment, the Check for Understanding, will be nestled above it. So make sure you do the Check for Understanding and that you've turned in this web quest as well. And that's it. So tomorrow I will send out the link for the YouTube video for the lobotomist. I will also try to find, actually, I'll deal with that tomorrow. There will be some questions that go along with the movie, but it's a pretty interesting movie. You guys are going to be, it's interesting. You'll see. So make sure you take the Check for Understanding, turn this in, and then you're done. All right. I hope you guys have a great day, and I will talk to you later. Bye.